Good evening, everyone, and welcome to another hour of Healthy Conclusions, where we try to give our listeners important information on nutrition, exercise, and holistic, alternative, and integrative medicine. Please take a minute to visit our website at www.healthyconclusions.com and like us on Facebook. My name is Bob Nugabar, and I will be your host for this evening's show. Tonight's show is being brought to you by Altrua Health Share, which has been serving its members and families with their health share needs since 1997. Please take a moment to visit their website at altruahealthshare.org or call 888-244-3839 to see just what Altrua Health Share can offer your family for their health care needs. It could mean substantial savings. This evening, we have Steve Ackerman, who is a former president of Provisio, an industry research company which included companies in healthcare and wellness sectors. He's done a lot of work in those areas. He was a policy analyst for the government, both federal and state, dealing with impact studies of the Affordable Care Act and the role and implementation of healthcare exchanges. He's also a regular commentator on The Kevin Miller Show. Steve, welcome to the Health Conclusions Show.
Thank you for having me, Bob.
It's always a pleasure. I'd like to start off because healthcare is such a crucial issue now, and it's being talked about in our Congress. I'd like to go through a whole bunch of questions for you about what your thinking process is on some of these issues. First of all, could you give us your current assessment of the current legislative issues that you consider critical to reforming healthcare in our country?
You bet, and thank you for having me. I think the kind of elephant in the room, if you will, is the federal reform of the Affordable Care Act, and I would say if you step back and look at it in general, you can kind of put the whole reform effort into three big buckets. One bucket is getting rid of mandates, getting rid of taxes. That's one bucket. The other is trying to reform the private healthcare market, and then the third is Medicaid expansion and how to limit expansion and reform Medicaid. And those are kind of the three big buckets. And it's kind of like I guess I'll say it's kind of like three balloons that are somehow attached to each other. As you push in one part of any balloon, you're going to kind of reshape the whole thing. So any change they make is going to have a kind of a mix of positive and negative consequences in other areas. But that would be the big kind of issue. Beyond that, it's really what individual states are doing. And individual states are doing really kind of a mix of two things. Number one, they are trying to move more on wellness programs, largely being driven by companies getting smaller and smaller. And then the second is really, trying to be just more efficient with the dollars they're using to try to cover as many people with as few dollars as possible. So broad landscape there.
Do you think that if we do get Medicaid, not the expansion, but just regular Medicaid, and it comes to us in the form of block grants, that the states are going to become laboratories for showing different ways in which we can format Medicaid and deliver it? And that would be a better idea than having the government set the rules.
In general, yes. And you and I have talked about the block grants. So there's the traditional block grant, which is literally a pile of money sent to the state. So just kind of see it as a bucket of money sent to the state. The other way, which they're talking about in the reform, is actually what's called a per capita cap. And that means basically you are allowed to spend a little more money on certain individuals as needed, but there is a limit, a cap on the total amount. So the benefit of the block grant is that you're sending a pile of money and you're telling the state, divide it up as you see fit. And the states automatically think, okay, that the upside of that is you're controlling costs. The downside is the state has a growing population. The per capita cap allows the state to say, okay, we've got some people with more problems. So maybe we increase a little bit of spending on some people and we try to account for the growth and maybe negotiate with the Congress. It tries to put a little flexibility in there. The downside, of course, is you may be spending more money from the federal government.
All right, that brings us to something that I have been an opponent of for some time, and that's third-party payments. And I've been opposing that in general for many years because it never makes the recipient of the care aware of the actual cost of the treatments. How do you think we can solve that problem? Because I believe if it doesn't change, healthcare costs are going to continue to rise, regardless of what else we do.
Yeah, that's a good point. The problem with the third party is exactly what you hit, and that is that the patient, the buyer of healthcare, is removed from the actual price. And any market, and I'm kind of putting on an economist hat here, but any market requires a price, right? An exchange price for good or service, and that voluntary exchange. If that price is removed, then the patient doesn't really understand what the costs of the healthcare are. And that's really the big problem. And in fact, a lot of the reform in Washington is really not reforming healthcare, it's reforming insurance. So even that is not connected so well, directly to the cost. So you're hitting on it. The problem is, if you will, there's a lack of transparency in knowing the price.
Well, I was just going to say, there's not necessarily a lack of transparency with the third party that's paying it. It's just with the individual that's the recipient.
Right, but they're the buyer, right,
Right.
at the end of the day. So if we look at them as the consumer or the buyer of the health care, they should know what the cost of it is. And the price is a signal, right? Prices are signals. If the price of oil goes up, it's because there's a war in the Middle East. Or there are problems, right? Or if we see the price of natural gas going down, we might connect it to additional fracking activity. So we can make these kind of rough, and in general we're right. So the price is a signal, and it's telling us how to behave, what more to buy, what less to buy based on the value of that good or service, how affordable it is, how much we need it. So the bottom line, to kind of come back to your point, your core question, and that is third party. So when you put a third party in there, you remove that transparency to the consumer. So they're not exactly sure how much they can buy because they don't know how available it is. And if they don't know how available it is because the price is very low, because they're, say, only paying a little bit of an upfront, a $20 copay or something, then they might overuse the service. Not trying to overuse it, they just don't know any better. And when you have doctor shortages and trying to get hospital other providers up, that becomes an issue as well.
We always talk about the free market in insurance and how we need to have more choice. And do you think the public should have more freedom to choose not only their health care provider, but also the type of treatment they want to receive? Because when you look at the insurance policies, they restrict you to what we would consider allopathic medicine or regular medicine nowadays. So that people who want to use natural medicine like chiropractic or acupuncture or naturopathic doctors don't have that alternative in most cases.
Yeah, I would say in general, and we've certainly, in general, yes. You want people to have greater choice. You want people to have more options, especially if those options can connect to them either preventing an issue down the road or, for example, acupuncture, chiropractic care, massage therapy, yoga. I know you had Tai Chi interview, recent interview. So all of those might help to prevent a worse onset of, say, low back pain, which can become a big problem. Or it might make potential arthritis or bursitis or some other, joint problems, for example. It might help alleviate some of those issues. And frankly, a lot of the way people work when it comes to their office, they're not always as ergonomically, kind of equipped and working as well as they can for shoulder and neck problems and things like this. So it could prevent future medical costs, and that's really its value with some of these alternatives.
So you agree that we should have alternatives when it comes to choosing what type of health care we want to accept for ourselves or use for ourselves. And indeed, that's not an option in many cases now, except for 3 states in this country where they actually do permit this. It was part of the Obamacare Act in Section 2706, which was non-discriminatory. So this here proposes another problem. If you only have one set of doctors that you are allowing to be used now, and we have to change that, how would you propose health care be delivered to better achieve cost effectiveness and obtain better outcomes, if not by diversifying the choice?
Yeah, I think in general what we see in markets, and we see it in food, which is a big driver of nutrition. One of the things we see is as we have a greater choice, we tend to have lower prices, because really greater choice for the consumer is more competition on the firm side, on the supplier side, the business side, if you will. So if we were able to offer more of these different types of choices, and I know more and more over the years, they have backed a lot of these kinds of approaches with different studies. And my condition is kind of always the same, as long as there's kind of an acceptance in the market, if you will, that the quality that's being advertised, for lack of a better word, is actually coming through. Then all kinds of things can, all kinds of choices can be allowed, and why not? And you could have insurance companies that may be focused strictly on integrative or naturopathic.
Okay, Steve, we're going to have to take a quick break here. We'll be back in a few minutes. We're listening to Healthy Conclusions, brought to you by Altrua Health Share, with your host Bob Neugebauer on 580 KIDO AM and 107.5 FM. Welcome back to Healthy Conclusions on 580 KIDO. We're speaking with Steve Ackerman. This show was sponsored by AltruaHealthShare.org. So, Steve, we were talking about competitiveness in terms of types of health care that we get. I believe that we're heading for a health care crisis in our state, with 16 to 20% of our population either on Medicaid or should be on Medicaid. We know that the continued rise is unsustainable, and Washington is already looking for ways to cut back. What would you do if you were in charge, and what would you change to address this problem?
Well, it is a problem, and a lot of people in the kind of political world, they focus on, they make arguments about fraud, and Medicaid really doesn't have a lot of fraud. It's actually a pretty strong program. However, Medicaid is suffering from the same problem we see in the private health insurance market, and that is the increasing cost of health care itself. And that's what's driving up premiums, driving up deductibles, and on the Medicaid side, it's driving up the cost of the benefits. And so if I had to kind of, there's no silver bullet here, but one thing that would be helpful, and the Affordable Care Act and HIPAA before it do allow for it, and that is that I would encourage more of a wellness approach in Medicaid. There is some, but we ought to have financial and other rewards tied to it. In other words, if a person voluntarily joins and what they call participatory joining or participatory wellness program, if they join and they start engaging in activity that is better, call it lifestyle or strong disease management, actual medical, if they move down that road, they get rewards. And since Medicaid traditionally focuses on, for example, single mother, a woman with a baby, make the rewards tied to discounts off diapers, discounts off baby food, discounts off, and various kind of financial rewards so that she is kind of better off in other cases. One of the problems with Medicaid today is that the Affordable Care Act got rid of the traditional way we define Medicaid. Medicaid was always given to, for example, a mother with a small child, a person with a disability, a person who is blind, etc. It always had some attached medical or kind of other problem to the person. Today, under the Affordable Care Act, the expansion is a certain income or below. They're saying basically people at low incomes are probably not as healthy as people of high incomes. And that's not a very accurate way to define it, but it also exploded the population that qualify for Medicaid and thus exploded the costs. And you have these kind of core people historically, a mother with a child who the child needs care and needs more care for a period of time than an adult. So putting a 25-year-old male or a 25-year-old female who don't have children on there is not the same as a person who, a mother with a child or a father with a child, or somebody who is blind or something or has some disability. So I think this is part of the problem with Medicaid. But if I had to wave a magic wand, I would say let's inject more wellness in there and let's tie it to a financial reward.
I've been doing a lot of research on integrative medicine over the past year and a half and the role it might play in reducing the cost of health care and producing better outcomes through incentives to Medicaid recipients and requiring participation in the wellness programs, which you just talked about. Do you feel that that would help the situation if there was a requirement to be a participant in a wellness program if you were going to receive Medicaid benefits, and that the incentives or an incentive way to do this is the best way to do it?
I tend to go to the incentives. I find that incentives, tend to drive a lot of behavior, both kind of positive and negative, when we talk about incentives in general. And it's a pretty strong, it's not only a strong economic concept, but you see it applied. So I would say yes, if you incentivize people. Look, I can tell you this. I can tell you that when we look at a company, they will get maybe 20% of the employees who are willing to join the wellness program. If you tie a financial incentive to it, a reward, sometimes it can be almost double the participation rate. So, incentives work. So I would say, whether it's a private or public, the population will generally respond to incentives. People respond.
You feel this would be a crucial part of any program that we were to institute in this state if we wanted to change and actually get to the root causes of these problems and get people back to wellness instead of sick care.
Yeah, I think it would. I think it would help. And look, where you're going to find the big help now. Do we require it or do we make it voluntary? That's kind of a political decision out there. However, here's what we know. We know that most wellness programs demonstrate their success with people who already have a problem. That's really where they're good. So somebody has chronic heart failure, asthma, migraines, et cetera, COPD, the range of things, low back pain. If they have these problems and you get them on a good wellness program, and again, I would cite, I would kind of back up what you're saying there in terms of not limited in terms of the kind of the range of therapies, really make that a very integrative approach, right? Anything that can be backed up by good science, et cetera, can qualify. We find that the savings can be pretty tremendous. And so we'd see that with the Medicaid population too, with somebody on Medicaid who is diagnosed with diabetes.
I've been saying for years that Idaho has a problem with the health care because of the transparency and the cost of procedures and the doctors that are locked into the network insurance companies, reducing competition in our state. How do we solve that problem?
Well, I think you can solve that problem by trying to open up a couple of areas. So the big kind of the big criticism in Idaho is that our market is so small that if we opened it up across state lines, that's the only way we could get the volume to lower the cost. But the problem is you'd have your doctors kind of so far away geographically, you'd have an issue. So my argument is you've got to flip this. You've got to do what kind of Charles Schwab did and in the investment world, and that is, don't make people go to the lemonade stand. You got to bring the lemonade stand to them. And so you need to use online. You need to use kind of other mobile. You need to use some different avenues to get to the population. And what you have to do is you have to open up the insurance market within the state, or if we're going to have it be across state lines, have some kind of a regional approach. In other words, have Washington, Oregon, Idaho, and Montana, for example, and tie them together.
Well, I agree. We have such a distance between rural communities and the major cities.
That's part of our problem.
In our state, it is a major problem. Why do we only have 2 hospitals on our state, and only one has any transparency of their costs of procedures, while the other is about as opaque as a black hole?
Yeah, well, that's not good. You always want transparency in pricing. Number one, you want the cost to be out there. What I would argue is even if we only have 2 hospitals, we should be seeing many more clinics pop up. This state has been pretty good when it comes to charity care clinics. And charity care clinics have actually shown to offer a lot of savings because they're dealing with people who have chronic problems. That's really your big cost driver. People who have chronic problems now who are not being treated regularly, who are not following the prescription regularly. That's really your cost driver. So what I would argue is, yes, we only have 2 major hospital systems, but as long as we can have more clinics, as long as we can have more of those pop up, including in the rural areas or especially in the rural areas, then we can kind of competitively be better off. But we need more of that.
But the question is, how do you get those clinics to pop up? You need money to do that. You need volunteers to do that. You need equipment to do that. Do you do this through a grant process or a 501c3 process? I know I've thought about doing that myself. In fact, I'm in the process of doing some of it.
Yes.
Is that how you get to that point?
That can help, but you got a problem because you got to make sure you got the population to back it up, right? If you spend a lot of money on a piece of equipment, you've got to have enough people, enough volume to make it worth buying the piece of equipment. That's the fundamental challenge. So, to the extent that we can do things online, to the extent that we can, and you have talked about it and been leading in a couple of areas there, to the extent that we can go more mobile. To try to scoop up as much of the population as possible. I mean, if you're going to put up a big building or if you're going to put up a piece of equipment, you need volume.
Okay, we've got to take another break here. We'll be back in a few minutes. You're listening to Health Conclusions, brought to you by Altrua Health Share with your host Bob Nugabar on 580 KIDO AM and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Steve Ackerman, sponsored by Altrua Health Share. So, Steve, we're talking about how we're going to solve our healthcare problems because we are so rural here. There are several major insurers, none of which operate in Idaho, that have seen incredible possibilities for offering complementary, alternative, and integrative therapies that are both efficacious and cost-effective. Why do you think we haven't seen more interest from Idaho companies in this integrative medicine process that's going on, particularly in the state of Washington, for the past 20 years, because it's such a huge money saver?
And I don't know if I'm going to give you a great answer. My guess, my sense is that they're heavily reliant upon, I don't know what the right word would be, kind of like maybe the American Medical Association or kind of the established kind of medical groups out there. Insurance companies are risk averse, and so if kind of established medical boards, if you will, if they say, look, these are what are acceptable, these are conventional, this is what is kind of low risk, an insurance company is going to follow that. They're not necessarily fast adopters when it comes to any kind of alternative. I think the medical world can be a little better, but they're not always better. But I've certainly seen examples of hospitals that have been willing to kind of bring in some different alternatives. I remember my mom told me she used to work at a hospital, public hospital, county hospital, and she told me that in the 1970s they were bringing in acupuncture, and they were doing acupuncture in a county hospital, and she said that was seen as revolutionary at the time, but the doctors were having a lot of conversations with the acupuncturists and saying, okay, how are you, questions around nerve related questions and response related and some of the potential side effects. And she said that the doctors were saying this is fruitful, this is a good add-on, this is something. So I think if the kind of grassroots medical doctors, if they're willing to move there, then I think your more established Boards would do it.
Well, we believe that's kind of an educational process,
Yeah,
and that's
I
going to
think it
take
is.
some time. But when you look at what's happened at the VA, when they originally started using chiropractic, it was an alternative medicine.
Correct.
It is now standardized. They do not call it an alternative medicine
Right.
anymore. And by the way, Washington State has been doing and has required insurance companies to cover integrative medicine, alternative and complementary, for 20 years,
Yeah.
and they have been very successful in reducing the costs of health care in that state just by making that change. Do you think it's possible at some point that we might actually see that change take place here?
I don't see why not, because as you mentioned, I've done industry research, and I've done work with a lot of the Blues, including Blue Cross of Idaho. But I've done work with about 10 of the Blues, the Blue Cross Blue Shields of the world. And for example, I know Blue Cross Blue Shield of Tennessee some years ago. They actually bought a wellness company and integrated that wellness company right into their company and made it part of the actual insurance policies they offered. So the insurance companies in general don't have a problem with it. I just think they move sometimes slowly because they get nervous about how far out, if you will, how unconventional they're willing to go.
Well, they're always looking at actuarials and always looking for mainstream. They're never looking for the innovations in many cases. We currently have a sick care program in our country and state because we never have or require accountability from the patients or results from the doctors in their treatments. What would you think would be a solution to get accountability from the recipients and to require results from the doctors?
I would say that you go after it with a wellness program, and you take advantage of what HIPAA provided and what the Affordable Care Act actually helped. And there are very few areas. The Affordable Care Act has a lot of problems. But the one area where it did help is it allowed for a person to get a financial reward of up to 30% of their premium cost. So if a person's paying $1,500 a month at a premium, they could get a reduction in that premium of up to $500 or some financial reward of up to $500 if they participate in a wellness program that is either based upon meeting some outcome goal, a better health outcome, is one, or the other, that they have to fulfill a certain activity. So if they account themselves for having to do certain things to meet a certain outcome, they can get a reward of up to 30%. And the Affordable Care Act allowed for that. And if it's tobacco related, it's up to 50%. So there are some things we could do with wellness, and it's a way of trying to deal with especially people who have chronic diseases.
Well, I mean, you have done a lot of research in the wellness companies and in your past history, and currently they're the fastest growing companies in the corporate world. 50 to 70% of the corporations in our country now are using wellness programs to save money. Why is it that we don't have a wellness program here in Idaho when we have 36,000 state employees and we also have these Medicaid recipients? And we have nothing to work with to try and keep people well. We know they're sick, and we're trying to fix them. We should probably use different types of medicine to do this, which we've talked about. But how do you get these wellness programs into a state like this, who I don't think really wants them?
Well, I mean, the big reason that you've got a 50 to 70% take up rate by corporations is costs. And at the end of the day, and I went through some stats. So Johnson & Johnson, for example, they saved $250 million over a decade. Basically, for every dollar they spent on wellness, they got a savings of $2.71. Now, I've seen figures as high as $3.27 for every dollar spent. In other words, $3.27 saved for every dollar spent. And that's actually a savings in the reduction of absenteeism. So now that one's a study that's kind of an outlier, but you can safely argue, I think, a 2-to-1, that for every dollar spent, you get a $2 savings. Now, that's a lot of money. And that's the reason why, Kaiser has 200,000 employees on wellness programs, or Humana have their employees on, Coca-Cola, Johnson & Johnson, as I mentioned, SC Johnson, Rich Foods. I mean, there are a lot of companies, and they're now really given the web and what all we can do with the web and telephonic nursing and such. We're really reaching down to those smaller companies so that they can scale. So I would argue that it's cost. That's what's driving it.
Well, if we're talking about cost here, if we instituted the wellness programs and we're able to save that kind of money, what would keep us from, actually lowering the rates or self-insuring the employees of our state ourselves?
That's right, and that's exactly it. I mean, companies like ConAgra and others have looked at self-insuring, and they've even done self-insuring for smaller companies because insurance is not a very complicated process. The key is, do you have enough money to back the estimated claims, number of claims and amount per claim, to be able to cover that? Do you have enough of a cushion? That's really the driving question. And good actuarial studies of a population can give you that. You have to have history, but you can get that. So really the answer is more of that can definitely move, can definitely get out there and prosper.
You were one of the first, I know, in the state to put out a petition to get rid of the mandates of Obamacare to reduce costs. Why do you think hardly any of our legislators signed on to that petition or supported your suggestion?
Yeah, it's been disappointing. I was going to say it's been somewhat slow, but it has been disappointing that they haven't. I think the way my guess is they look at Obamacare is where it's at. We're going to, as a state, we're going to comply with it as best we can, try to make it fit as best how we want it. But, they don't want to take on any kind of a move.
So you don't see them moving in that direction anyway. And actually, what I have seen is that I don't think they know enough about health care to understand what the mandates are in many cases.
Well, that's a good question, and I mean, I think one of the problems, with the 10 essential health benefits, it does raise premiums more, and it does require people to buy things, whether they need them or not. And I believe that if you combined if you allowed the individual market, which is really the problem here, if you allowed the individual market to be able to buy as an association, in other words, individuals buy as a class, they could buy in bulk the way the group market works, and it would be more price competitive.
We've got a serious problem with opioids in this country, and we're going to have to take a break, and we're going to come back to that in a minute. You're listening to Healthy Conclusions, brought to you by Altrua Health Share, with your host Bob Neugebauer on 580 KIDO AM and 107.5 FM. Welcome back to Healthy Conclusions on 580 KIDO. We're speaking with Steve Ackerman, sponsored by AltruaHealthShare.org. Now, I was just about to ask you a question about the serious opioid problem in this country that's costing between 50 and 100,000 lives a year. And now the Senate is fighting to do something about this serious health problem. We've been trying to get medical marijuana in Idaho for 3 years, and the governor keeps vetoing the bill, and it has not killed anybody from overdosing. Why do you think our legislators and the governor allow these opioid problems to take place, but they don't seem to want to allow medicines like CBD oil to be legalized in our state? This kind of drives me nuts. Is it big pharma? Is it because they don't get enough campaign contributions from the marijuana growers? Or, what is the problem here?
Well, I think there's a couple things. Number one, the opioid, as you mentioned, is being dealt with, in the Senate reform of the Affordable Care Act. It seems to me that the governors, and in particular law enforcement officials, and doctors, obviously, would have a better handle on that. There's been this growing, slowly but surely, there's been this kind of growing problem of prescription drugs and kids getting access to prescription drugs of older family members, et cetera, right? That's kind of been building as an issue. But it seems like nobody's kind of grabbed onto it, and all of a sudden now it's the opioid, so everybody's pointing to that. So, I would say that law enforcement and healthcare officials are the ones that should have been consulted with kind of early on, because they typically see things. They see people coming into a hospital, and they see why. I can remember when I worked in a hospital in an ER. You could see the trends of what the popular drugs were by people coming in with from a bad high or an overdose, right, and problems from it. So that's really where the good intelligence is on it. I'm not sure why there's that disconnect. When it comes to CBD oil, I think the medical marijuana problem, and I'm just going to put on a political hat, I think it's a perception problem. I think when they talk about medical marijuana, they show somebody smoking a joint, and that sends a signal to people that you're going to allow all of this marijuana to come in, when CBD oil is actually something separate. It's a chemical.
It doesn't even contain THC.
Exactly. Yeah, and even in some cases, I think there is a bit, but it's so small.
It's minute.
It's negligible. Yeah, it doesn't have an effect on the body that is noticeable by the person. And so I think the problem has been the way they I'll say it this way, the way they message it, the way they package it. We would give people cocaine in a hospital. Now, it was pure cocaine. It was medical. It was designed to do certain things for blood clotting, and it had, but this is a chemical. So I think if CBD oil is presented on its own instead of couched in the medical marijuana, we would see it as an actual chemical. And also, I would argue, kind of more generally with medical marijuana in some of the different states, why does it always have to be offered as smoking?
Well, that's true. I mean, I've seen it in brownie format and cookies and slushies, you name it.
Yeah, but something that's shaped and kind of designated more medically, right? I mean, kind of, whatever it is, like if something chewable, like look a lot of the animal medication. A lot of the animal medication is packaged as some kind of a chew.
Maybe we should put it in an injectable format so they think it's actually something that gets right into the bloodstream.
But that's the key, right? The key is the chemical. It's not.
Of course, it is the chemical. There's no question about it. But how many people in your history of being in a hospital you saw come in with overdose of marijuana?
Very few. It was really at my time when I was in, it was PCP. That was the big problem.
Well, that we know is a problem.
Yeah, that's a real problem. It was PCP, a little bit of LSD, mainly PCP, and then it was cocaine and crack cocaine. Yeah, those are the big drivers.
Well, by 2025, we're going to have a shortage of 90,000 physicians in the U.S. I mean, these are numbers that have been put out there. They're real numbers. There are 1 million alternative and complementary practitioners that are not currently covered under insurance. And we've talked about this earlier. Wouldn't it be a good idea to turn to integrative medicine and utilize these practitioners' skills, if not only to resolve the patient load, but to reduce the cost of the actual medications? And we've seen, and I've done the work, that integrative medicine can substantially reduce the costs of taking care of people without a drug being part of the recipient's way to wellness by using natural medicines. How do we fix this problem? And don't you think this would be at least an idea that should be thrown out there for people to look at?
Yeah, I do think it's an idea to be considered, because you're hitting on the supply side here, the resource shortage, and that resource shortage, that supply shortage of doctors, that becomes worse in the current way we do insurance, because if a person only sees the copay and they don't actually see the full kind of cost of the care that they're getting, they may overuse the care, which means they're going to overuse the doctor. And if the supply is short to begin with, that's going to be even worse. So you have a demand side problem that's going to make that worse. It's going to exacerbate the problem. So what I would say is we've got to come up with a way to kind of, through the medical community, as kind of a market, provide some kind of a certification here and allow for the alternative practitioners, if you will, the alternative doctors, to be able to take up some of that demand at the end of the day. And frankly, then I would also add in wellness. And again, with people, especially with people who have chronic problems, dietitians, nutritionists, respiratory therapists. I mean, there are amazing number of non-physician, medically qualified people that can help here.
So let's go back to the problem. We're going to have shortages. We know that. We're turning out a fair amount of physician's assistants, but here in Idaho, they can't attend to anybody without a practicing MD, sitting there or being by their side or in the room or what have you. Why wouldn't we be able to go to a mobile app where you could have a physician's assistant up in Rigby or up in Chalice, where they could be in contact with an MD? Why wouldn't we be able to use the new modern-day techniques to help these people? And, you talked about having a mobile vehicle. That's very costly. But we have all of these electronic means of communications. Why couldn't we use these?
I see nothing wrong with that. In fact, I think it's a great idea. The insurance companies and, frankly, the hospital and kind of medical billing world have got to catch up a little bit with technology, and that is you can have a visit. And that visit be the person is on a screen, and it's you talking to a person on a screen. Why not have an MD on the screen as you have a PA working with a person in the room, and have an RN around, and have a registered dietitian or whatever. I mean, why not utilize it? Definitely.
Well, I think we're going to have to start utilizing the available people that we have who have training. And that are actually producing some good results when it comes to integrative medicine. There are very few doctors in our state now that are integrating, but there are a few, and they're having some big success, especially when they include the wellness programs, because that's the real key here. If we can't keep people well and we can't change their lifestyles, we're going to have this problem continue to get worse. It's not going to change. And it's kind of like when you go into a chemotherapy ward and they've got ice cream and cookies and all kinds of goodies sitting on a table along with soda pop, when those things we know you shouldn't be eating. Sure, so don't you think it's at the doctor's behest to start being a little more critical and a little more thoughtful in the fact that there are other alternatives. There are other things we should be doing. And maybe we have to look outside the box, which is what I've been saying about medical care for years. Nobody looks outside the box.
Yeah, I think you're right. And you brought up the point about chiropractic care at one time was seen as an alternative. And now that's seen as a very conventional.
Well, I want to thank you very much for being with us here this evening. Yeah. And joining us for the insights you've given us into the healthcare situation, both nationally and here in Idaho. This is Bob Neugebauer signing off for Healthy Conclusions. We hope you will join us again at the same time next week for another hour of informative talk on nutrition, exercise, and alternative medicine options, sponsored by AlchuaHealthShare.org. This is 580 KIDO AM and 107.5 FM, signing off.